As healthcare providers, we know that it's incredibly important to recognize implicit bias and to respect patients' choices. For many of us, that is a given, but I also think it's important to be thoughtful as we explore this question. So I have the privilege today of connecting with the Patient Empowerment Network's Vice President of Programs, Aicha Diallo, a leading voice on this topic. It's such a pleasure to connect with you today, Aicha.
Thank you so much for having me.
So, Aicha, can you define what is bias? And can you also discuss the different types of bias?
Absolutely. Implicit bias is also known as unconscious bias. It is a cognitive process that is unintentionally activated when a person automatically classifies another person as a member of a group and applies stereotypical characteristics of the group. This could be positive or negative. But the issue with implicit bias is that it could be common and persistent, and it can be activated very quickly and unknowingly by situational cues. That could be the color of someone's skin or an accent that they're hearing. And it can also impact a person's perception of a situation and a memory and even their behavior without that person's intent and awareness. So the different types of biases that you will find in the healthcare system are race and ethnicity bias, age bias, sexual identity, gender, education, even appearance and ableism. Social economic status and geographic location are also huge biases that tend to be seen. The impact that bias does have on healthcare delivery is that it can lead to lower quality care among patients, specifically from underrepresented communities. And it can also result in, unfortunately, incorrect diagnosis, mistakes, delays in treatment, and even further mistrust and distrust from the patient community. So it's really important for healthcare professionals to be aware of any implicit bias that they may have and really work hard to remove them. And they also have to pay very close attention to any blind spots that can be often present, that can obstruct their views. And the other thing I would also add is that they need to really have the willingness to suspend the quote unquote what they know about a person based on generalizations about their culture and really be open to what their experience as their personal culture.
Thank you, Aisha. And so, you mentioned the types of biases and you mentioned the impact that they have on healthcare delivery and the type of care that our patients receive. You also said that it's unconscious. And so I would love for you to share, how can providers actually recognize this implicit bias? Are there some practical ways that they can actually recognize their biases?
Absolutely. I think it's very important to reflect on one's own identity. It's important to keep in mind that your patient should be treated equitably, with respect, with dignity, empathy, regardless of what they look like, who they are, what language they speak, or where they live. I would also and continue to encourage to practice cultural humility, which is really taking a step back, listening to your patients, being present, allowing them to share what their thoughts, questions, concerns are, and to really avoid making any assumptions. And I would also add that it's important to participate in courses to educate yourself on health disparities and cultural identities. Also, check in with your colleagues and make sure that you are on the same page with the way that you are interacting with patients.
And finally, can you explain the importance of respecting patients' choices, even when they differ from our own, and how this extends to including our care partners in the process?
I think it's very important to understand as a healthcare professional that you are the expert at what you do, but your patients and their families are experts at who they are, what they feel, what they want and need. So making sure to always engage in shared decision making and including them in the process as well as their care partners in all the conversations, and remembering that their care partners are an essential part of their loved one's care and often make the decisions with or even for them. So listening to both your patients and their care partner or whoever is in the room with them, that also extends to any additional loved ones that they bring with them. Ask them about their goals and their concerns. Make sure that you make eye contact with them. It makes them feel included as well in the process. And direct your questions to both parties. I think applying these strategies are very important in this process.
That was wonderful. Thank you so much, Aicha. So if I could summarize what you've said, you've told us about bias and that implicit bias is unconscious, and so we're typically not aware of it. You've shared some strategies for us to mitigate our biases, and you've talked about the importance of including our patients and their family members and support people in the decision making. So thank you so much for sharing your expertise with us today.